Dr. Richard Aron recently returned to Cape Town after practicing in London since the mid-80s. His speciality is paediatric atopic eczema.
In the conventional treatment approach, there are three main items which are and can be effective in eczema, and they are steroid creams, antibiotic creams, and moisturizing creams. The trick is to get the right balance of these three components. If you achieve the right balance and you make the overall treatment relatively simple for the carer to apply, you can then get a satisfactory result.
So the conventional ingredients that dermatologists are using are the same as yours?
I have an approach whereby I dilute the steroid in the moisturizer according to the age, size, and weight of the child. I use it intensively in the early stages of treatment, reduce the frequency of application as the child responds to treatment, but I don't stop it suddenly. And I may continue with these dilutions of steroid cream for prolonged periods of time, 3-4 months or even longer in some cases. And it is that maintenance therapy which reduces the potential for the eczema to recur, because eczema is fundamentally a recurring problem.
Dr. Aron prescribed a mixture of creams for Malik that was made up by the local pharmacy. Margaret had to apply the mixture 6 times a day.
When did you start to see an improvement?
Immediately after I'd given him a bath and I'd applied the mixture all over his body, calmed him down and put him to sleep, and he slept for hours. He slept, and he slept the next day, and he slept the day afterwards, and he just continued sleeping, and his skin gradually, in terms of the way skin looked, it calmed down quite a bit, but it wasn't 100% improved immediately. But by the second week, there was an 80% improvement from what he's always been like.
There's nothing new about Dr. Aron's remedy. It contains all the same ingredients that other doctors prescribe for eczema, but the only difference is the quantity of the ingredients and the way it's applied.
I believe in using a much weaker steroid for a much longer period of time in association with an antibiotic for a very, very important reason. Because when eczema children's skin gets infected with bacteria, the particular bacterium involved is called Staphylococcus aureus. And Staphylococcus aureus has great fun on eczema skin. And what it does is it releases a poison called an exotoxin. And that poison creates havoc on the skin. It actually creates flare-ups of the eczema. So I believe that you need to use an antibiotic cream in conjunction with the steroid cream and the moisturizer, because if you eliminate the Staphylococcus aureus, you have a reduced potential for flare-up.